question answer sessions or maybe case discussion. So let us start our session, and I hope you understood the meaning of dried sensation on the lips, because that was a very important thing which I told you last time. And the remedies oleum jack and I think chilidonium, which oleum jack I told you what are the symptoms of oleum jack and when you should consider using oleum jack in your practice. A very interesting remedy, though a rare remedy, but interesting remedy. So as we go further, let us see some of the other questions. Like for instance, there was a question where the patient wanted to know something about anxiety. Now, as I've always told you that see, anxiety is basically a very generalized rubric. It's a very generalized rubric. So it may have lot of variations and lot of remedies, but you should have exact meaning of anxiety. What is anxiety, and what are the other rubrics that define the anxiety of patient? Anxiety. If you open the repeater, there are so many rubrics for anxiety. Anxiety in the morning, anxiety in the evening, anxiety in twilight, as it is said in the children's, anxiety while waking, or anxiety while doing work. Lot of anxiety. So you always have to define your anxiety before you basically start to repertorize and get the remedy of anxiety. So we welcome Dr. Babel. Welcome. So I was talking about anxiety. Sometimes what happens at the basic anxiety, what you have to look in your practice. Yeah, good afternoon, Tony. That I had a very interesting case whether the patient had conceived, she had abortion of the first child and the second child also. Third time she conceived and she had tremendous anxiety that she will abort again. So much so that she used to get sometimes pain in the abdomen also, mimicking as if that abortion would happen. It was a very interesting case, and in that case I gave the remedy, very interesting remedy, Kali Carb, and the whole anxiety, the whole symptoms which mimic abortion, everything was cured. So that was a rubric taken, anxiety with threatening abortion. So this is an example I've given you that people have anxiety where during pregnancy I gave her Kali Carb, and which worked very well with that case. In the same way, some people have anxiety when they are alone, like phosphorus, cannot stay alone, arsenic, rustox, drosera, calibrom. They cannot stay alone. Anxiety when staying alone. So these are different types of anxiety. Like anxiety, you must have seen anxiety anticipation, anxiety during an engagement, or anxiety before meeting somebody. So there are a lot of permutation combination in this rubric. It's a very big rubric. So before taking that rubric, you have to see whether that rubric defines the patient. If the rubric defines the patient and defines the whole characteristic of the patient, then only take the rubric for anxiety, because it is a soric rubric, and every people goes through a patch of anxiety in many parts of life. So anxiety is taken basically as a very common rubric which I have seen. But if it defines the person, like anxiety I told you, which threatens abortion, or anxiety before breakfast, or anxiety in asthma. So in this case, then you can think about a rubric and take the appropriate rubric and give the remedy. Okay. So as we move further, any other question? So sometimes it happens that although I will always believe there has to be cause for everything, but there is a rubric where it is written that anxiety is sometimes causeless. There is no cause of anxiety, but still the patient suffers from anxiety. Now we have a rubric, but what is my clinical experience is that everything you should have a cause. So anxiety also must have a cause, but there is a rubric where if you get that rubric that the patient has anxiety and there is no cause for anxiety, then the first remedy that you should think about is Brownia alba. And second remedy, which normally has given me very good results, it's again a rare remedy called as Zincum valeriana. Now Zincum valeriana is a very, very interesting remedy where the patient suffers from anxiety without cause, or it is said as causeless anxiety. If you open mathematic of Zincum valeriana, Zincum valeriana is a very interesting remedy. In Zincum valeriana, it is written that the patient suffers from violent neuralgic headaches. So much so that the patient suffers from uncontrollable sleepiness because of pain. A very, very interesting symptom of Zincum valeriana, that is uncontrollable sleeplessness. The patient is so sleepless because of headache, he cannot sleep only. Uncontrollable sleeplessness because of headache, and because of which the patient becomes very much dull, gloomy, or melancholic patient. This is a very, very interesting and a very, very important symptom of Zincum valeriana. In most of the cases, I have confirmed this, that is uncontrollable sleeplessness from headache or from pain. In fact, Zincum valeriana is a very, very interesting remedy when there is sleeplessness in children's. Sometimes the children cannot sleep and there's no cause for that sleeplessness. There's no cause for this sleeplessness. You can take that anxiety causeless and give Zincum valeriana, which will give you very good results. One more symptom of anxiety of extremities of Zincum valeriana you should remember, that is the patient cannot sit still. Like in Zincum maybe fidgety feet, Zincum valeriana is more important in my practice. I have seen cannot keep still. He must keep the legs in constant motion. The legs of Zincum valeriana are in a constant motion. If the patient is coming in front of in the OPD and you see that the leg is continuously moving, you tell him once, twice that don't move like it is disturbing, but still the patient is unable to stop the motion of legs. That is a very, very, again, an important symptom of Zincum valeriana. So 2-3 symptoms that you have to remember. That first is uncontrollable sleeplessness during with headache, and second, the patient cannot sit still, must keep the legs in constant motion. That is again a very, very important symptom of Zincum valeriana. So this is just, I was telling something about anxiety. If you have some questions, you can always try some questions. Otherwise, I have some questions more on the WhatsApp. If I don't have, I'll start those questions. Yeah. So one of the questions on WhatsApp, again on anxiety, I've clubbed this question. So again, I will try to tell you one thing only. In anxiety, always remember, please think about the rubric which defines the patient. The defining rubric of the patient becomes the most important rubric of the patient's personality. That is important. Yes, any other questions? Be fast. Anybody? Suppose, see what happens, there are cases now, there are cases of viral cases are coming, and there are a lot of fever cases you have gone, we have come across. So there is a very interesting case where the patient suffers from anxiety with fever, or you can say anxiety during fever. Now, if there is lot of anxiety, during fever, 2-3 remedies that should always come to your mind. First and foremost is Aconite Napellus. Second is arsenic album. Third, you'll be surprised, the remedy is Ipecac. And fourth, I use lots in my practice, is sepia. Very, very interesting rubric, a very, very interesting remedy. These 4 remedies are the main remedy which I have seen in my practice, that is anxiety during fever. Of course, there are a lot of other symptoms that you have to match with this remedy with fever complaints, but if you get a case where there is a lot of anxiety during fever, definitely we have arsenic, we have Aconite, Ipecac, sepia, but other remedies like pulsatile is also there, I think Rustox is also there, phosphorus is also there. These are a lot of other remedies which have anxiety during fever. So this is the season where you'll get a lot of case of cough and fever, and if a case of fever is with anxiety, you have to look at this remedy, that is Rustox or phosphorus or arsenic or Aconite, sepia and Ipecac. So these are the general remedies which I am told you regarding anxiety. Lot of common cases will come to you. There are a lot of questions of anxiety on the WhatsApp, so I'll complete those questions. Good afternoon, Dr. Amit. So a lot of other questions, a lot of other very important anxiety that you will face in your practice. A lot of patients will come to you, that is anxiety after fright. Now, fright is a part and parcel of everybody's life. You can get frightened lots time in your life, and there will be lot of symptoms after fright. And whenever the patient tells you anxiety after fright, okay, I had gone, somebody had scolded me if a student says, or something has happened and a frightful incident has happened in their life, and after that the patient says there is a lot of anxiety, then that becomes a very, very important problem. In fact, I had a very, very interesting case when after the person lost the election in the college, he was so frightened, So much frightened that he could not do anything in life. Always always anxious something will happen, some lot of anxiety. And I gave that patient 1 dose of calibrom, calibromaticum. Calibrom is a very, very interesting remedy whenever there is anxiety after fright. Of course, if you always think about, first of all, ignitia, we think about silesia, but calibrom is a very, very important remedy whenever there is anxiety after fright, and it is not always that you should think about symptoms, interpretation. This interpretation part of a remedy is a very, very important thing. Otherwise you will start searching for remedies which are very rare, and you will start interpreting very, very rare symptoms, and sometimes you may or sometimes you may not get. But this symptom of calibrom is very important, that is anxiety after fright. So much so that in calibrom it is written restlessness and sleeplessness. Remember, restlessness and sleeplessness due to worry and grief, from loss of property or reputation, from business embarrassment. We have never thought about calibrom, but in today's world, because of corona, there are so many businesses which have shut down. There are a lot of loss of reputation, property has gone back, property has gone, and because of that, if the patient suffers from anything, the first remedy you should think about is calibrom. It is beautifully written in Allen's keynote: restlessness, sleeplessness due to worry, grief, loss of property, loss of reputation, from business embarrassment. The remedy is calibrom. And I had lots and lots cases in corona where small businesses were shut down and the patient becomes so restless, so anxious, no sleep, and he had tried a lot of other medicines with a lot of doctors, nothing gave relief. In those cases, I have used calibrom 1 ml single dose, and it has given me very good results. So this calibrom is a very, very interesting remedy when there is anxiety from fright. Of course, think about ignitia, think about silesia, think about veratramal, and one remedy again which is very useful where the patient says is restless and gets lots of cramps and twisting in the muscles after anxiety and fright from, that is cuprum metallicum. Cuprum metallicum again is a very, very interesting remedy when there is anxiety from fright. And this rubric will come to you in your practice very frequently, very frequently. You understood? So this you have to keep in mind, and then you have to prescribe in anxiety. Again, I would like to tell you, make sure that you think about anxiety and these remedies, because anxiety is it's a very, very big rubric, and whenever you're prescribing on big rubrics, it is very important to understand what rubric to take and in which part of patient's life to take. That is important. So this is how you have to deal with anxiety. And anxiety of fright I told today because I have a lot of cases, as I told you, about corona. After that, anxiety started, and that's why it's important to understand the meaning of anxiety. So I think a lot of people have joined. Welcome, Dr. Sharon, Avni, Alexandra, Jadhav, Shman Gupta. So yes, any other question? One question is there, I think. Yeah, difference between Ras Gabara. Is Ras Gabara or Ras Glabera? Yes? Yes, I think it's Ras Glabera, I think, but still you can correct it and I'll tell you. Hello, Dr. Mahesh. Can we take rubric left to right in case of abdominal tumour? See, if you ask me which rubric to take at what time, I can tell you, you can take anything which defines the disease personality or the patient's personality. That is very important, because if I take a case, I have always told you, if I take a case, I can interpret something else, and if you take the case, you can think about something else. So as I told you, if you write on a paper that patient thirsty, okay, patient thermals chilly, but when the patient sits in front of you and tells you, I'm chilly, I cannot bear cold, then the meaning of chilly changes and this changes. So it is very important to understand. If, of course, but I will tell you one thing, you can definitely take the rubric. There's no problem. It has to define. Yes. Now, Ras Glabera. Good afternoon, Dr. Mishra. Ras glabera. I'm very happy that somebody asked me a very interesting remedy, Ras glabera. And in Ras glabera, if you have seen Mater Medica, Ras glabera in fact is a mixture of 2 and 3 medicines. That is, one is Sticta and one is China. Of course, there are some symptoms of Ras glabera which are also indifferent. Ras glabera important symptom is epistaxis and occipital headache. The patient will always have occipital headache with lot of epistaxis. That's a very important symptom of Ras glabera, and the patient has dreams of flying through the air. This is a very interesting, and I've seen in many of cases when I use Ras glabera, dreams of flying through the air. A very important symptom again of Sticta pulmonale. And profuse perspiration arising from debility. The patient is so weak, and because of which there is lot of perspiration as in China. So these two symptoms are there in Ras glabera and also in China. It's a very important remedy. It is written for bowel complaints. In Ras glabera, if sometimes the patient tells you the flatulence is so offensive, it is so offensive that when the patient is in the room or in the house or he comes out from the bathroom, the whole bathroom or the whole room smells of the odor of the flatulence. So this is an important indication of Ras glabera. Ras glabera has a very important symptom where the flatulence are very offensive. It is written in, I think, Mater Medica that it is a very important remedy to disinfect the bowels. This is the wordings written in the Mater Medica. So this is what is my experience of using Ras glabera. Now something about hyoscyamus. Now what to tell about hyoscyamus? Hyoscyamus everybody must have used, and I think they taken hyoscyamus something when I was telling something about I think cough of hyoscyamus, loud cough, it can be heard in the room and all. See, hyoscyamus, yeah, suspicious and all. So this is basically what happened. This is normal Mater Medica where we have seen hyoscyamus used. But there are other indications also of hyoscyamus where you have to understand and prescribe hyoscyamus. Can anybody tell me something about hyoscyamus more? Yes, anything about hyoscyamus? Remember, hyoscyamus is a patient who is very much irritable, nervous and hysterical. These 3 words will describe hyoscyamus in your Mater Medica: irritable, nervous and hysterical. See, betrayed and shamelessness, everything is there, but these 3 rubrics are very important: irritable, nervous and hysterical. Yeah, shameless. In hyoscyamus, you must always remember bad effects of unfortunate love. Bad effects of unfortunate love, and the patient because of that becomes very jealous. That is hyoscyamus. And that's why, because of the irritability and all, the patient suffers from that irritation everywhere in the body. So there is a lot of irritation in the mind and in the body. You can think about irritation in the bowels, recurrent stools, patient has a lot of pain, cramping pain in the eyes. Put that irritation, you get the eye symptoms also. So this is a very interesting symptom of hyoscyamus, that is irritation, hysterical and irritability. Of course, I cannot tell you the whole drug picture of hyoscyamus because it will take a lot of time, but these 3 symptoms which I have seen, and because of that the patient get convulsions, the children get convulsions, there is convulsions from irritation because of the worms, there is because of irritation of the mind, there is increased cerebral activity, because of which the patient has a lot of twisting and restlessness. He jumps off the bed, tries to escape from the bed. This is hyoscyamus. And because of that hysterical temperament, he goes in delirium, and because of that he acquires the place between belladonna and stramonium. See, this is irritation is there, and the patient lacks that cerebral congestion. The congestion is not there. Irritation is there, and because of it the patient goes in spasms without consciousness. Every muscle of the body twitches. That is hyoscyamus. So you have to understand the remedy in 2-3 words so that you can always think about and use that remedy whenever that symptoms comes for prescriptions. This is something short which I could gather from my knowledge of mater medica. Good afternoon, Dr. Smita, Dr. Mahesh, please. Sir, please explain metaphorical meaning of hard and soft on superiors. Yeah, see what happens. Hard on inferiors, soft and superiors. If you take a plain meaning of this, means a person, say, I'll tell you an example. A person comes to the OPD, he gives the whole case to the assistant comes to you and tells, sir, patient बहुत ही egoistic है, he is very egoistic, वो पता नहीं अपने आप को क्या समझता है. He was telling, I am this, I am that, I want the doctor to meet XY, blah 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 blah. But the same patient, when he comes to inside the chamber, he starts talking like, sir, how are you? Thank you, you have given me time. I hope you will cure me. Exactly opposite to what your assistant described. This is the meaning of hard on inferiors and soft on superiors. I hope you get the meaning, and rightly ask question. There are a lot of other metamorphical meaning of this. Let me whenever I have a case where a case comes to me, I'll explain through a case. But this is how you interpret rubric, very very simple in your OPD. If that patient, only the assistant, you follow the assistant, you will take the rubric egotism and attitude and all that rubric. But if that same patient comes to you, you think the patient is timid, the patient is servile and so submissive. See the difference from rocking from the assistant chambers to your chamber, from haughtiness to servileness in 1 minute. So it is very important to understand, as I always tell you. Some people will ask me, sir, which repertory book to read and which. I always tell you, don't read anything. Take out the repertory, see the rubric, see by yourself the meaning of that rubric, and then automatically try to see in your patient. This is how I have studied repertory or mater medica, and I've got fantastic results. Characteristic mental symptom. Anything which is very striking about the patient, that is a characteristic mental symptom, and it will take a long class for that, Suspicious, hello Dr. Agnes Smith, betrayed, shameless, Dr. Sharon says, lasciviousness, Dr. Mishra says, मैग्निफेरा क्यों हो सकता, क्या विटिलिगो ऑन कॉर्नर ऑफ द माउथ, एक्सप्लेन. मैग्निफेरा इंडिका मदर टिंचर, लेट मी टेल यू, आई हैव नेवर यूज्ड इन माय प्रैक्टिस फॉर विटिलिगो. सेकेंड, if vitiligo is in the corners of the mouth, you can take from Bert mater medica the action of medicine on the mucocutaneous junction, and then you can prescribe the remedy. For example, nitric acid we have. See, most of the cases in vitiligo basically are symmetry. They follow the symmetry. Means left cheek, right cheek, on the forehead, middle of the forehead, of the nose, on the spine. Symmetry. वो सिमेट्री में चलते हैं. राइट पे आएंगे तो लेफ्ट पे भी आएंगे, लेफ्ट पे आएंगे तो राइट पे आएंगे. एग्जैक्टली जहाँ यहाँ आया उस प्रकार चलते हैं. ये दिस इज ऑल्सो वेरी इंपॉर्टेंट एंट्री पॉइंट इन केस ऑफ विटिलिगो. बट इन विटिलिगो यू डेफिनेटली हैव टू आस्क द डिस्ट्रक्शन इन द माइंड. मीन्स एक पेशेंट, डॉक्टर मिश्रा जी सुन लीजिए, एक आदमी सोच रहा है कि मेरे को ये लाइफ में बनना है, बट नहीं बन पाया, और वो थॉट उसको दिमाग में इतना बैठ चुका है कि वो थॉट के बाहर ही नहीं आ पा रहा है. वो देयर इज टोटल डिस्ट्रक्शन ऑफ दैट थॉट. ही कैन नॉट वर्क इन लाइफ, कैन नॉट डू एनीथिंग ऑफ लाइफ. वो छोटा भी थॉट हो सकता है. वो थॉट का डिस्ट्रक्शन की वजह से मैंने बहुत केसेस देखे हैं जिसको विटिलिगो या ल्यूकोड्रामा हो जाता है. तो मैग्नीफेरा इंडिका तो मैंने कभी यूज नहीं किया, बट ये थॉट प्रोसेस अगर आप शायद पेशेंट से पूछेंगे तो आपको बेटर रिजल्ट्स मिलेंगे. फीमेल राइट शोल्डर एंड लेफ्ट लंबर पेन, 1 month, aggression sitting, aggression ascending stairs. ये शोल्डर का क्वेश्चन बहुत बार आता है. Anybody, can you give the answer? Shoulder pain, very very easy. Dr. Jyoti Vaishnav, good afternoon. So a female which has pain in the shoulder, right side. Again, which remedy can we think about? Anybody? Chilidonium. Yes, very much right, and I'm very happy that at least whatever I had taught, I think in the previous YouTubes, everybody is knowing something. Now she has told other symptoms also, and left lumbar pain. Now right shoulder and left lumbar pain. So it is diagonal complaints. You can take that also as a prescribing symptom. The pain comes or You can say the symptoms are diagonal. Now, if the symptoms are diagonal, you can have other remedy. What are the other remedies? Diagonal complaints. Of course, I have told you that I'll tell you one remedy which is very common, and that is Agaricus muscarius. Anything else you can think about? Agaricus. No, Agaricus I have already told you about. So see, in this case we have two symptoms which the doctor has told us. It is right shoulder, left lumbar, since 1 month, aggravation sitting, aggravation ascending stairs. Now, in repetization, it is very important that the remedy covers both the 2-3 rubrics. In this case, you have to think about 3 remedies which I can think about in my practice. Now, see, diagonal symptoms pain, if you have seen your pain diagonal, that is, we have rustox also, we have agaricus also, we have taraxacum, we have lycopodium, we have cilicia. This remedy comes to women. But now she has told right shoulder and left lumbar pain. Aggravation sitting. So in this case, she has given the whole case. So in this case, whatever I can repetize from instantly, 4 remedies will come to the repertory chart. First is Calcarea carb, second is Calmia latifolia, third is lycopodium, and fourth will be nitric acid. These 4 remedies will definitely come to a repertory chart. Of course, you can always repetize and you can get some remedies. One remedy that is very, I think, I would not say uncommon because I have used that remedy in my practice, which is also important in this is Asclepius tuberosa. That is Asclepius tuberosa. You can write down the spelling also. I think the spelling is ASCLEPIAS, Asclepius tuberosa. This is a very interesting remedy. Right shoulder and left lumbar pain, if I am not mistaken, is there. It is written in that remedy. You know, sometimes the shoulder pain are very stiff. There is lots of fluid, and also it is written in this remedy. You can write down. It increases the secretion of the skin. Increases the secretions of the skin, the serous membrane, and the mucous membrane, which causes profuse perspiration. Very called as colliquative sweat. Very interesting remedy. Increase secretion of the skin. कभी भी आपने सोचा है कि ड्राई स्किन के लिए ये रेमेडी यूज करने के लिए यूज करके देखिए, if there is no other primary cause, but the secretions, increasing the secretions, you know, it has a lubricating effect. A very interesting remedy. And the patient suffers from numbness from the whole body. And how did I get the remedy? Because there was a case where the patient told me that whenever somebody is smoking or eating tobacco with the smell, I am very sensitive. I start getting headache, I start getting ear, anything. So this is also covered in Asclepius tuberosa, that's sensitive to tobacco. This is how I got to know and learn about this remedy, that is Asclepius tuberosa. Second, in Asclepius tuberosa, one symptom is very important, that the patient suffers from dry cough with constriction in the chest. Because in a lot of cases where post-corona, gone, given lot of medicine, but still the patient suffered from बहुत सूखी खांसी आती है और chest में घुटन लगती है. I have used Asclepius tuberosa, and one more symptom that was there in corona, that is shortness of breath, and the patient feel very weak on walking. So sometimes it happened that sternum metallicum did not work. So I used this remedy, Asclepius tuberosa, where there was shortness of breath and weakness on walking. So it was a very good question and a very good symptom told by Dr. Sarkar. So these 3-4 remedies you should think about. And Asclepius tuberosa I told you because it's a very interesting remedy which I have used a lot in my practice. And if I am not mistaken, it has also pain in the right shoulder and left lumbar region simultaneously. Yeah, agaricus is there, Simasifuga is there. So Dr. Mishra says old injury, back pain, recurrence of right side. Of course, Dr. Mishra, अगर back pain का problem है, if there is a pain in the back because of injury, the first remedy that should come in everybody's mind, and that is definitely Arnica montana. Of course, a long duration. I told you one remedy, you know, if anybody can remember, I told one remedy where it is elements from injury. If arnica is not working, ruta is not working, belly spur is not working, but still there is pain long after injury, which remedy you should think about, and that was Sconium maculatum. That works wonderfully. If the person is old age, it would work definitely wonderfully. Menstrual cramps, bearing down to legs and headache. Now, menstrual cramps, again, can you give me some more symptom? Because menstrual cramps, if we start from A, it will end in Z. Any other symptom that basically will describe that cramps? Anybody? Yeah, doctor. Any other symptom? See, you can have so many remedies for that. What to tell you? You can start with a simple medicine Macphos. You can start with a simple medicine Macphos, or you can start. Macphos is there, Usteligo is there, Millifolium is there, Kalicarb is there, ammonium carb is there, Semisefuga is there. Lot of remedies. But you can think the remedies which you should think about is Macphos, Semisefuga, Kalicarb. Okay. Recurrent UTI, Staphylococcus treats an attack and you use a tincture but keeps recurring. And see, Dr. Whitehead, a very interesting question. I think I told you once also that in recurrent UTI, if nothing is working, I don't know other symptoms because I normally take the whole case. Which remedy that should come in your mind? I told you once, and I told you use that remedy in LM potency. Which remedy I told at that time? Anybody? Yeah, fantastic, Dr. Vishaka. E. coli. If you have missed that E. coli and if you have not given E. coli, you must give the remedy E. coli in LM potency. UIURC, I think Dr. Whitehead already used. UIURC is a fantastic, E. coli is a very, very interesting remedy. Very, very interesting remedy. And it will work because I have seen very, very good results with this remedy. Of course, there are a lot other remedies apart from this, but E. coli, you can write down E. coli is there. Second remedy that you should think about is, I have told you the pain of that, as if straw is there, the patient has to bend down and all. That is Spruna spinosa. Very, very interesting remedy. Third remedy that I have found very, very useful in my practice, you can write down, and that is, write down the third remedy, and that is again a very rare remedy. Again a rare remedy, that is Triticum repens. Triticum repens. Triticum repens. Repens. Very much painful urination, during urination painful, recurrent UTI. Triticum also works very well. And the fourth remedy you should think about, that is petroselenium. Petroselenium. One remedy where the pain is so much that the patient has to hold the organ while passing urine, you must think about cannabis sativa. But recurrent UTI, E. coli, triticum, petroselenium, very, very interesting remedies. These are very, very interesting remedies. So I think one of my experience on using oxydendron. Yeah, oxydendron, I have read about the remedy, but I have not used till my practice. So theoretically I can say, but practically I have not used, so I will not comment on that remedy. I have not used this remedy in my practice till date, to be very frank. Okay, so I have not used it. I hope, Dr. Gillen, you understood some 3-4 remedies. I should tell you E. coli. Try triticum also. It's a very, very interesting remedy. And third is petroselenium. Petroselenium also will give you wonderful results. It's a very interesting remedy, where the patient has a symptom of sudden urgent urinate. Sudden. That is important. Yes. So anything? Next question. I think a lot of questions have scrolled up. But sulfur, arsulflavum. Actually, arsulflavum, it's a fantastic remedy. I don't know when I was old age forgetting. Arsulflavum, let me tell you that when we were studying homeopathy, that we were only told one thing, and that was cases of leukoderma, white spots and all. But in my practice, I have seen when I have used arsulflavon in my practice, in leukoderma, I have not got so many good results. But arsulflavum, let me tell you, don't prescribe for what you call that skin symptoms or hair symptoms or eye symptom, because it is a remedy which has a it's a combination of arsenic, sulfur and fluoric acid. So if you ask me, arsulflavum, what do you call, in this type of company, I'll not be able to share, because I don't use arsulflavum only for skin complaints, but the whole constitution. uh, it's as I told you, it's a combination of 3 4 remedies, and because of that only it is I've used that. Arsulfame, remember one thing, it is very very important in that case: anemia and physical anxiety. Anemia and physical anxiety. And suffocation on going upstairs. Now, suffocation on going upstairs basically is not related to stairs. Not related to stairs, but related to studies. As you go further in your life, like second class, third class, 12th class, then your graduation, then PGs, as the patient goes higher and higher and higher, there's a lot of anxiety and a lot of suffocation, whether the patient will be able to do it or whether she has taken a right line. That is what I say suffers from anemia and physical anxiety from suffocation. That is a very, very interesting, and the whole case revolves around that symptom. It has a very interesting symptom in skin, where the skin symptoms are continuously relapsing, nothing works. The skin basically dry, parched, itching is there. No modality is neither better by heat, neither better by cold. The patient cannot understand how to answer. That is arsulflavum. You can say, beautifully written in Kent, that is lack of reaction. And that's why the patient desires to lie down alone, wants to be alone, does not want anybody to be around him. And that's why whenever arsulflavum starts working, in most of the cases I have seen, the patient wants to come back to what he was, that is Sora, or in his house, with the parents, with the friends. He wants to come back. This comeback symptom of arsulflavum I have seen in most of my cases when I have used arsulflavum. This is very, very important in arsulflavum. The patient wants to go back to Sora, wants to go back to the loved ones, which at once did not want to see the face also. That is arsulflavum. In short, okay. Bacillinum 1M, okay. Urea. Yeah, just one more question, Deepak. Good afternoon. Most striking symptom, yeah. Whatever I have told you, Dr. Alexander, this was basically I've used in my practice, and I've got good results. And let me tell you, most of the cases I've used only through mind. Only through mind. Okay. So we have a question, a very interesting question, the use of urea. First of all, let me be very clear. Let me be very clear that I have not used urea in cases of renal failures where the urea was very high, and I gave urea pure, the medicine, and the patient was better. I have not used urea in these cases. I have used urea in cases, you'll be very surprised, in cases of dropsy, especially renal dropsy. It's a very, very interesting remedy, which is basically I've used in renal dropsy. And whenever it is written in the matter remedy that kidney cannot eliminate the waste products, or it is called as uremic intoxication or uremic coma. I had a very, very interesting case of schizophrenia. Let me share. It is basically out of the world prescription, but let me tell you the case where the patient had the lady basically had an affair and had a physical relationship with somebody, and when she got married, she could not get that thought out of the system, where she felt that she has done something wrong. That thought was killing her, though she had discussed with that husband, but there was no relief, that she could not eliminate that. So it was as good as a waste product for the mind. In that case, I gave the patient urea pure 1 m single dose and I got back the patient from schizophrenia to normal. So it is written in the Mater Medica that it eliminates waste and uremic coma and the urea count very high. In my early days of practice, I used to use lot of urea and I did not get any results. So it's not that it does not get results, it get results, but I have used urea in these cases mentally. When the patient is not able to take out the thoughts, though everything is settled down, but still that thought prevails. In that case, you, my dear friends, use urea and you will get very, very good results. This is my experience in using urea. Entry point about alopecia areata. Alopecia areata, let me tell you that I told you, I think last time only I had a beautiful case of alopecia universalis. The child did not have hair in any part of the body, treated with allopathy, treated with homeopathy for the past 3-4 years, nothing happened. Entry point I would tell you in alopecia areata was the only thing that the patient lacks glamour. The patient wants to look smart. The patient wants to look better than others, always starts comparing, I don't have this, I don't have that. In that comparison, maybe young or maybe old, suffers from alopecia areata, whatever cases I have seen in my practice. So do think about these symptoms when you're treating case of alopecia areata. In experience with cases of rhinosporidiosis where complaints of are mass in left nostril with occasional bleeding. Yeah. In this case, I have used the most common remedies. In some cases, I have got results. In some cases, I have not got results also. That is tuberculum, calcarea iode, agrifus nut, lamina minor, xanthoxylum. And I think in one case, I used the remedy fluoric acid also. So these 5-6 remedy have given me fairly good results in my practice. Of course, as I told you, some cases I've got good results and some cases I've failed also. So this is what I've seen in my practice. 18-year-old, eczema on hands, very thirsty, history of kidney disease as child, graphitis, sulfur, no improvement. He responds well to naxonic but not on skin. Eczema on hands, thirsty, kidney disorders and all. So what is the type of eczema? Eczema, that is very important for me to understand. Type of eczema: dry, wet, dry flakes. Now whenever if you get these type of cases where the patient has eruptions or eczema type basically on the hands, 2-3 remedies that basically comes to my mind. The first remedy you should think about with kidney disorders: arsenic. How did you forget arsenic? Don't forget arsenic. Arsenic album, sorinum. 2 remedies, very, very important, very, very interesting. And one remedy. I think you must have heard, or I don't know, it's a very rare remedy. That remedy is anilinium. ANILLINUM. A very, very good remedy. It is basically amino. It is, I think, amidobenzene. It's an amidobenzene. So this is eczema. Of course, there are sorinum, arsenic, and aniline. You can think about Merxol if kidney disease is there, and the last remedy that I will use, Staphylococcus aureus. But think about arsenic first, sorinum, anilinum, Staphylococcus aureus, and Merxol. Dry plaques, yeah. 44 minutes have gone. I have a webinar at 4 o'clock. Can I have 2 more questions? See, then you have upper arm, lower arm, upper limb, lower limb. In upper limb also, we have basically, Dr. Tony, you must think about one remedy also, which is very important. That is Bovista. If the patient has taken a lot of allopathy medicines or homeopathy medicines or other Ayurvedic medicines, lot of local application has been done, and eczema is there, lot of tertiary eruption, lot of plaques, and lot of itching, blackness, discoloration, think about Bovista. Think about Bovista, Allen's keynote first line, tertiary eruptions. And one remedy again, you must think about when it is upper limb, that is Dalkamara. Dalkamara. So these 4-5 remedies are very, very important. Dalkamara and Bovista, do think about that if it is the upper limb. Okay. If Few more questions. Ask some good questions so that I can tell you some implied symptoms also, implied rubrics also. Urea, I hope, I'm very thankful that somebody asked about urea, because there were a lot of misconceptions in urea, that urea cures renal failure and urea kam ho jata hai. Kidney failure is a very tricky disease where the creatinine is so high, the urea is so high, very difficult. Urea pure, if you give in low potencies, the urea will come down. You stop it back to square one, or after some time it will stop working also. So make sure that you don't use urea only for kidney complaints, but it has definitely other applications also which you can use for. A very good question, and I'm happy that the level of questions are also increasing, so are going so much high. That's important for me to understand and learn also. Dr. Mishra, I think I said something about, I think bacillinum, I don't know. It is basilioco, I don't know what's the remedy, that is bacillinum is there, I think. So I think there are no more questions. Every question, most of the questions are answered. So next time we meet again, same day, one question. I have a case of eczema which sulfur is working, but slowly. And I'm sure in a sulfur salt, the similimum. Okay, okay. Yeah, you can tell me something about the case, so we can definitely have some talk on that. One more question is 20-year-old female suffers with amenorrhea since menarche and raised LH in FSH and prolactin. Please guide. Dr. Deepak, very, very important in this case. You have to take the whole case because it's absolutely the hormones absolutely disturbed, and because of that, everything is so. In this case, you have to take the whole case and give the prescription. Okay. Experience on Glyceria glabra. No, I have not used this remedy, so I cannot tell you the experience. I'm a doctor who uses a lot of polycrestone and can get good results with polycrest remedies. So I'll not be able to answer these rare remedy questions. I am not so read about this rare remedy. Aggravation in heat of summer, but better by bathing. Okay. I think sulfur salt, if you're very sure the patient is sulfur, it's okay. And if sulfur salt is there, then if the modalities you see this better by bathing and all, if the patient is better by bathing, I would be surprised that sulfur is indicated. But still, if you feel that sulfur is there, then you must think about if there is discharge and all, you must think about I think she has a lot of arsenic in it, so she speaks very fast, like you. Okay. Arsenic basically, I would not say would speak very fast, because arsenic speaks very fast and very crisp. Very crisp. And if the fluoride element is there, it has to have some syphilitic symptom on the body. Then only use some syphilitic mind also, absolutely ruthless, absolutely loss of sympathy, absolutely this type of complaints if you have, then you must think about arsenic. You can think about, because if you see, I have seen in a practice the person who speaks very fast, there are other remedies also. So arsenic speaking is very fast but very crisp. It's like very crisp. It's like if you blow a whistle, it's a crisp sound. That's arsenic. You can think about arsenic album, but if arsenic flavum, the fluoride element, the syphilitic element has to be there. Cracks is psychosyphilitic. No, restless physically means fluoride. Fluoride elements is basically emotionally the patient is cut off. Emotionally the patient is cut off and wants to live alone and not bothered, and she thinks that she is good. That is the fluoride cut off element. That has to be there in arsenic flavum. Okay. Very intelligent. That you could have written very intelligent like me. Then I would have said give arsenic flavum. Okay, arsenic flavum is definitely intelligent, but first of all, it comes out from confusion. It's a very practical remedy. Means that the arsenic flavum does everything in life after some practical experience. She fails, the person fails, then comes back. The fails and come back. So he has a very practical experience of life, and that is arsenic flavum. So I hope you can get me the whole case, then I'll give you the remedy. And a typical face of arsenic flavum, you can see the face of arsenic flavum also. That's important arsenic flame. So if you feel you can give arsenic flame, try the limb potency first, because you can repeat in those cases. So it's already 50 minutes. So let me sum up this webinar. Good questions. I also learned a lot of things from you, and meet you next time, same day, same time. Thank you so much.